Hi, I'm John Heeg. Welcome to my Man Cave Classroom, where today I'm going to be talking to you about tourniquets. I have a tourniquet here that was used in the wars in Iraq and Afghanistan, and then I have a tourniquet from World War I. This is a German tourniquet. Now, if you look right here, of course, this is a much more updated one. We've learned a lot from World War I, but the concept is very similar. It's used like a belt. You have windlasses on it. Now, the reason tourniquets are important on a battlefield is this. The number one thing that's going to kill somebody on a battlefield is a massive hemorrhage. And by massive hemorrhage, we're talking about arterial bleeds that can come from your brachial arteries or your femoral arteries. Arteries carry blood away from the heart, if you recall from science class. But the way I like to think about arterial blood flow is thinking about a hose in a water fight. Think about it in the summertime when you're in the backyard. You're throwing water balloons at each other. Somebody has water pistols, but then all of a sudden somebody gets smart and they go and get the hose. And at the end of that hose, you have the nozzle. And that nozzle is putting out a lot of pressure. And the person who has that hose has a significant advantage. Now, if you're a little sneaky like myself, you outflank that person with the hose and then you kink the hose. Once you kink it, either water stops flowing out of that nozzle altogether, or it's the water pressure is severely diminished. Now, the reason I bring up the water hose is this, is because the water hose is your artery. What you're trying to do with tourniquets is you're trying to kink the hose, because when you have an arterial bleed, it spurts out like a water fountain. This isn't something you're going to get. This isn't the type of bleed you're going to get from an abrasion when you fall off your bike, right? This water flow, or blood flow, I should say, is going to spurt out like a water fountain. I know, gross, sorry. Now, the key here is that you need to control that bleeding right away. Because it's spurting out, you have probably 1 to 2 minutes to control that bleeding. And if you don't, that patient, soldier or Marine, is going to die. Now, the reason I bring that up is because when we look at the tourniquets from World War I and then the tourniquets that are used today, they're very, very similar. It operates like a belt. You have a windlass on there. Once you get this tourniquet on the patient, whether it be their arm or their leg, right, and you crank down the windlass, the bleeding is going to be controlled. But from World War I, for years after that, the tourniquet kind of has a bad reputation. Let me just show you how this tourniquet works. So again, I mentioned before, you open it like a belt, right? You can cinch it down. This tourniquet then will be applied to the patient's arm. Once it's applied to their arm or their leg, you cinch this down really tight. You open up this part right here. This is the windlass. Then, once this is on the patient's arm or leg, you're going to crank it down. You're going to keep turning it. Once the bleeding stops, you secure the windlass, like so. Put this on there, and then secure the Velcro piece right over here onto the patient, and then you transport them to the next echelon of care. Very easy. In fact, these are so easy to apply and so easy to use. Everybody who goes into a combat zone is trained on how to use them. And then, of course, they're readily accessible. You'll see them on soldiers or Marines' flak jackets over here. So they're very, very easily accessible. If you look at your World War I tourniquet, of course, we've learned a lot from 1914, 1917 up until 2020. If you look at this tourniquet, they had the right idea. If you think about it. You take this, you put the patient's arm or leg in there. You then crank this down with the windlass, and then you transport them to the next level of care. However, when we go from World War I up into the wars of Iraq and Afghanistan, there was a lot that took place that changed the use of tourniquets. When I was actually learning how to be an emergency medical technician in the early 90s, if you were dealing with a massive hemorrhage, you were told to apply pressure bandages, apply pressure points, and then and only then, use a tourniquet. It was like a last resort type of thing. Today, it's used very, very liberally. And the reason it's being used very liberally today is because, well, we learned a lot in the wars in Iraq and Afghanistan on how using these and how getting them to the next echelon of care actually helped to save that person's life. However, during World War I, this tourniquet and the use of tourniquets during World War I, it kind of had a bad reputation. So much, in fact, that doctors, when they wrote medical journals on tourniquets, or they were advising people on the use of tourniquets, they would say, hey, as soon as you see one, take it off right away. We're going to take a look at why is it that this tourniquet, which is being used very, very liberal today, why it kind of got a bad reputation during World War I. Now that my tourniquet is applied, my arterial bleed has been controlled, which is going to allow me to talk to you about two things, time and drawbacks. Now with time, when we're looking at time today, from the time a soldier or Marine is traumatically injured in the combat zone, they have what is called the golden hour. That within that hour, you're going to have to get that soldier or Marine that's traumatically injured from the combat zone to doctors who are going to perform surgery or other invasive procedures to save that soldier or Marine's life. Now, you have that golden hour, which means that this next number, for today's purposes, isn't really going to mean much. All right, with 2 hours, once you apply this tourniquet, the longer you leave it on, the more likely you are to suffer from muscle damage, tissue damage, nerve damage, whatever the case may be. Now, 2 hours when that tourniquet's applied, that's right around the time that you're going to start to see that. However, for today's purposes, that's not usually a problem because you're getting the soldier or Marine from the combat zone to doctors who are going to perform surgery within an hour. Now, since I just talked about time was something that was not on soldiers' sides during World War I. When it came to time, from the time that a soldier got injured in the trenches during World War I, from the time they got to doctors, that 1 hour, you probably didn't see that. And it has a lot to do with the terrain.
Not only is terrain going to be a problem when it comes to applying a tourniquet, but also it's going to be time. Let's look at where patient care started. Patient care often started in the trenches. A soldier comes down with a serious injury, a tourniquet is applied. Now it is up to you, the stretcher bearer or medic, to get that patient from one point to the other. When we look at moving the patient from one echelon of care to the other, there's a lot of time it's going to take to get them from one echelon of care to the other. And the other thing that's going to play a factor in this is that, is it safe to move them? Are the conditions appropriate for them to move from one place to the other? The trenches were great for helping to contain artillery fire that wound up landing in the trenches, but they were a disaster for moving patients around. When we look at stretcher bearers and medics moving patients around, the zigzags of moving these patients around in trenches often played a difficult role in moving the patients out quickly. And we also have to look at the fact that once you got them out of the trenches, then you had stretcher bearers who were moving around through mud that was 2 to 3 feet deep in certain situations. That does not help out the patient because that's going to take it much, much longer to get that patient from one echelon of care to the other. Another thing that we have to keep in mind is this. When it comes to the training of these young, brave men who were moving the patients from one echelon of care to the other, they weren't often trained to move these stretchers around within trenches. A lot of the training that was taking place was in calm conditions. They would calmly just come up to the patient. As a team, they would put the patient on there. A lot of the training that was taking place when it came to moving patients around didn't deal with the zigzags and the complications that you were going to deal with the trenches and the zigzags. The other thing that comes into play as well is that the application of the tourniquet as well. While the training was, as best as it could be to get these guys into battle, when it came to applying the tourniquet, sometimes that was also a drawback of it, is that the people who were applying the tourniquet weren't applying it well. When it came to moving the patients from one echelon of care to the other, if you're going to get the patient from the trenches to either a train or perhaps a ambulance that's going to take them from one place to the other, if you're in that ambulance, you're in a patient, and you're at the patient that's in the back of that ambulance, there's a lot of other complications that the ambulances had to deal with. There was lots of obstacles that they had to deal with, and that had to deal with making sure it was safe to proceed. Huge craters in the road. Sometimes these ambulances would break down. You had also nervous drivers who got lost. And when it came to getting to those next echelons of care, remember, you also want to make sure that that patient that had that tourniquet put on him was getting to a doctor. When it came to getting to a doctor, let's talk about where these patients might wind up. Again, doctors were overwhelmed with the amount of patients that they saw. So when we look at the tourniquet that was being applied on the battlefield, and you look at the time it takes for that doctor or nurse to finally see it, how much time is going by? Is it an hour? Is it 2 hours? And by the time that doctor sees that tourniquet that winds up on that patient, are they able to save that limb? When we look at the tourniquet being applied to patients and how it winds up getting a bad reputation, the time and terrain was not on the side of the patient. It was not on the side of the medical practitioner who's taking care of them. It also wasn't on the side of the reputation for the tourniquet, because while the tourniquet is an effective device, the thing that needs to come into play is that the people need to be able to train on how to use it. And then, of course, from when that arterial bleed takes place to applying that tourniquet and getting to the next level of care is very, very important. Thanks for watching.